Hey everybody, welcome to this week's episode of 5 Minute Friday. Today is all about prolapse, pelvic organ prolapse. I actually got quite a few questions on this topic, so it probably will be longer than 5 minutes, but we will get started anyway because there's lots of content to get through. So first of all, what is a prolapse? You can see here, I've got my trusty pelvis, and inside your pelvis, if you didn't already know, you have pelvic organs, and you have a lot of structural support holding those pelvic organs up. And basically what happens with a prolapse is the structural support for organs can be not as strong or not as good as they originally were, and they've caused your pelvic organs to basically descend down into the pelvic bowl. So there are 3 different types of prolapse. There you have basically got your bladder prolapse, uterine prolapse, and your rectal prolapse. They have much more scientific names, but those 3. So each of those organs can move, and some people might have a bladder prolapse and some people might just have like a rectal prolapse, and it depends on which part of the organ or which organ has actually descended down into the pelvic cavity further down. So there are lots of grades. There's 4 different types of grades of prolapse depending on how far that movement is. You have grade 1, 2, 3, and 4. And basically 3 is where the organ is starting to like actually be on the outside or at the entrance of your vagina. And you can see or feel like see it possibly. Whereas 4 is a bit further down, and then 1 and 2 is not as low. So there are different types of grades of prolapse as well. Another question I had was like, why do we get this? So basically the structural support of the organs has changed and is no longer as strong as what it could be. So this could be from high exposure to lots of loading and heavy lifting where there's a lot of pressure down onto the pelvic floor. So this could be not so much during just lifting, but it could be from pushing a lot onto your pelvic floor. So bearing down during movements. It could be from constipation and constantly putting pressure onto your pelvic floor all the time, and then it causing a prolapse as well. It can be from like damage during birth, or that's like physical damage that's either affected the tissues or the ligaments or structures around those pelvic organs. So it can also be from hormonal changes. Like a lot of women get prolapse occurring during menopause because our estrogen plays a really good role in important role in keeping our tissues nice and strong. And then it could also be something like a hysterectomy where one of the organs has been removed and now there's a space there, so they've moved in. So there's definitely different ways or reasons why you might have a prolapse. It's very commonly more spoken about in terms of childbirth and being related to that, basically because of the amount of pressure and load and stress that your pelvic floor can undergo during the birth and labor. So I think that's what lots of people mostly mix it with or associate it with. But in saying that, there are different possible options or problems as why you could experience a prolapse. Another question I had was, how do you know if you have a prolapse? Great question. Usually you will feel this. It is like a downward heaviness, dragging feeling in your pelvis somewhere. That could be mostly through vagina is normally where we would hear it. You can sometimes see it coming out if your organ is that far down. Or the best way to know if you have one is if you're not really sure and you do feel feelings like this, would be getting an internal examination done where they can diagnose that for you and assess whether those pelvic organs have actually prolapsed. So best way is to get a diagnosis. Now, is this reversible? Pelvic organ prolapse is not reversible in a sense of completely changing it back because there has been structural damage and the organs have actually moved down, but we can change symptoms. So building really strong support structures there, so strengthening up through pelvic floor, providing really good stability around your hip muscles, especially glutes because they're part of that pelvic floor structure, and making sure that you're really aware of how you're bearing your pressure. So whether that's pushing down onto your pelvic floor a lot, that could be causing more symptoms, or we talk about how to manage pressure so that it takes the pressure off those pelvic floor muscles. You can get some nice strength up through there and support those organs a lot better. So I've had lots of women who have had lots of improvement in their pelvic floor symptoms with correct exercise treatment and like a body awareness and movement patterns rather than reversing the problem as such. Some women can have a prolapse and then live symptom-free because they've really worked hard on that and adjusted a lot of their techniques or movement strategies. So do you require surgery for this? There is a lot of debate about surgery. However, you can, depending on the severity, surgery is an option. However, the success rate for surgery is actually not high in a sense of it not happening again. So from women who have had surgery, 58% have had a reoccurrence of their prolapse after they've had surgical intervention. And this is because their strategies around managing pressure and their pelvic floor strength just isn't there. So even though they've had the support change, the way they're doing things and bearing pressure down is actually what's causing their problems and creating the prolapse to happen again. So if you were to get surgery, which isn't always recommended, but if you chose to go do that, doing a exercise program around building strength in these structures and learning how to manage pressure when you're moving is so important in helping that surgery stay or be more successful. So if you are considering that, definitely look at what you're doing. However, you also don't need to get surgery. So you can do something about it other than that. That's not your first line option. It is an option for you, however, if you do want it, but I would recommend you get some advice on all of the other management strategies first because it's really, really beneficial for you. Let's talk about, can this heal over time postpartum if I'm very early on? So if you're super early postpartum and you have a prolapse, a lot of women, there's a lot of laxity around ligaments and your tissues aren't as strong. So you're probably going to feel like your prolapse is not so great and worrying about whether or not this can heal without any sort of physiotherapy intervention or exercise intervention. I have had lots of women say that as soon as they're stopped breastfeeding and their hormones have sort of gone back to like being a little bit more normal or non-pregnancy, let's say, so they're back towards like a couple of, maybe a year or two later down the track, that their prolapse has actually improved, their symptoms have improved, and this could be the effects of hormones and that fact that those tissues are no longer as lax as what they were during that pregnancy and initial postpartum phase. But in saying that, I would definitely recommend that you understand that if you have a prolapse, the way you move, the way you bear pressure, the way you work your pelvic floor and your breathing strategies all impact this. So even though it might initially improve based on those tissue changes, long term, I would be looking at trying to make sure you're aware of what you're doing in order to not continue to bear load and pressure on it to cause problems later, if that makes any sense. So I hope that's helpful. What about if I have a prolapse? It's better now, but I'm a bit worried about the next birth. Or if I was to have another baby, will it be a problem? This is very variant for people because lots of women don't, if they have their first child, they might be less educated around pelvic floor, how to use it during birth and labor versus if they've had prolapse or pelvic floor problems and then had a second baby and understand how to use their pelvic floor a lot better, how to manage pressure, how to use their breathing properly. So some women may have issues with that again, and some women might actually have a better experience. So that's really independent and very individualized. So doing the most you can around education and understanding it yourself is really going to be much more beneficial for you. So, and then what other question was the last one I had was, what can I do about training? If I have a prolapse, can I still train? This one is super crucial to understand that you can do exercise with a prolapse. However, it needs to be very individualized to how you move. So let's say, for example, you're doing strength training or running is usually the most problematic exercise protocols I see for women that have prolapse and they're worried about whether or not they can do it. If you understand structural support and how to use your pelvic floor, your deeper abdominals, your breathing pattern during those exercises, and regulate pressure so that you're not bearing down and pushing more load down onto your pelvic floor and creating higher symptoms of prolapse or putting more pressure on those organs and possibly furthering that prolapse grade, whether it's like going from a grade 1 to a grade 2 or grade 2 to a grade 3. That's what is really important. It's all about how you are doing the movement rather than which movements are actually problematic for you. Obviously, there are movements that are going to create higher pressure loading for you, such as really heavy lifting, and you need the structural support there in your pelvic floor and your deeper abdominals to support everything. So you need to make sure that you have that initially. You need to make sure that your movement strategies are really, really optimal and that you can correctly execute different movements. Then you need to make sure you can regulate that pressure in those movements quite well according to your core and pelvic floor strength, as well as your breathing strategies. And then basically you can keep training. You can just build some strong structural support around there and then progressively overload based on how you're going with the program. It is never a linear process in a sense of like it's always going to get better. There'll be times where lifestyle factors will contribute and your symptoms might come back, and then you go back to reconnecting with your core and your pelvic floor and like breathing strategies and strength training and mobility. There's a lot of things that can impact this. So you can keep training, but get some professional help on this, because if you're doing it the wrong way, it can indeed make things worse. So that's it for Prolapse today. It's been longer than 5 minutes. Sorry about that. But I think all that information is really crucial for anyone that's worried about prolapse or has prolapse and wants to understand a little bit more about it. However, if you are struggling and you don't really know what to do, please reach out for some help with a professional who can help you and navigate this space for you, because it's really important. And I think there's a lot of misconceived information about what you can and can't do with a prolapse and how it affects your, especially exercise training. So otherwise, thanks for tuning in, and I'll see you next week.